with lots of things in our mind. Now the doctor just went straight to the point.
Okay.
The doctor told us that the baby has a big hole in the heart. That is the time nilisikia hapa kwa Ujaluoni kitu inaitwa chira.
Aha.
Because now, you know, after 1 month, the baby could not feed well. We had the weight, we had low weight.
Yeah, it should be
failure
low weight.
to thrive.
Yeah.
Now those symptoms now were coming real. Now you see the real picture.
Welcome back to the Mamatoto Lounge. We are at the little cave. This place is splendid. Have you tried the accommodation and the restaurant? When you are having guests to host, this is a place to be. Today, we are joined by a very, very powerful friend. I should call her friend, I should call her a mother, who has turned her pain into purpose. This is a story from her heart, and we are going to ride in her story as we do a lot of learning and learning as well. It is her unfiltered story. Rafiki yangu, karibu sana. Please introduce yourself. Tell us who you are and where we can always find you. We are very humbled and happy to host you. You are looking all amazing. Karibu sana.
Awesome. Thank you so much. I feel honored to be in your midst today. My name is Lillian Vida, Mrs. Onyango. I stay in Mamboleo. I'm a mother, I'm a wife, I'm a woman, and I'm also a health worker. To be specific, I'm a nurse working in this county, and I'm glad to talk on a very special journey that I have encountered in a few years ago.
Asante. Thank you so much. When we spoke and you were ready to do this, I was deeply touched because these are the voices that we need. You are here to speak to us as a parent, and probably you'll be talking also on behalf of your children. So let's get to know you. How many children do you have? How has it been parenting? Please let us wear that shoe and dive on.
Well, I'm at advanced age, I can say. And, you know, I happen to be blessed with 5 babies. And the eldest being 29 years. I know you can't believe, but that's it. And I lost my second born at 6 months old of age, having an abort of what we call a rotavirus. It was quite challenging for me. So eldest to the 5th one, I have 29 now, 20 years old, I have 12-year-old, and the special baby have now at 9 years. So ranges between an adolescent and having special babies of the, what do we call them? Well, the retirement babies, those that can
leisure sleepers,
ebu kimbia all round.
Yes.
And they're really the two youngest are really taking me off guard, because now with the homework and everything, I also need just to recap and be in the not the Gen Z, what is this called?
The alphas. They are the alphas.
The alphas,
yeah.
So I also need to capture the system, the syllabus of the education, which for now it's quite challenging for me.
That's quite interesting. Putting on that shoe of, you have the 29 is a Gen Z?
29, Most probably a
Or a
Gen Z, but
millennial.
married now.
Yes. So
I
you have
even
an
have-
adult, you have adolescent, and you have now the wow. How do you
alpha.
balance?
Quite well, you know, as a parent, you also need to get your standards, and also in parenting, although it's quite challenging though, but for the 29, of course, she is now married. I have 2 grandchildren.
Whoa,
and she stays
congratulations.
far from me. Thank you. And occasionally also the grandchildren would come around.
Yes.
So like I really have quite a vast experience from from ranges of ages.
Yes.
Yes. Now.
And you see, I keep saying in this channel, time in, time out, that mothers don't forget. And I love the fact that you have mentioned your second born, who you lost at 6 months.
Yes.
Mothers don't forget, because your uterus will not forget, will not allow you to forget that was a pregnancy you carried.
Yes. And owing to that fact,
yes,
I think now I even found myself adopting a girl that I presume was of that age, because that was 2 or 3. Then I lost the baby 2 or 4 just at 6 months. So then I got a girl right from just a house help who was assisting me, who has been assisting me on my special journey. We have stayed like for 10 years, and she has a daughter. So I've blended the daughter into my family.
Wow.
So the daughter has just replaced, sort of replaced my second born, and I feel so encouraged even on today. She's just around. She's around. So she's like my pass.
You are a force.
She's blessed now. She has completed her 4th form. And now she's even doing a nursing, it's a CNA course, which has been influenced by me being a health worker.
Yes. You are a force, mommy. You are a force. You are a force. And we need such positive force all over. Wow. Congratulations.
Thank you.
Yes. Now there comes parenting, and you are pregnant, you're probably your planned last born, and things happen.
Yes.
Let us in.
Actually, you know, as a woman, sometimes these things are not planned. Because personally, by our plan, we intended to have 2 children. But when now we lost the second baby, and it has happened naturally that I've had the first 4 girls. Now, you know, when you have the first, the second, and by I'm a Luo, Basuba, married to a Luo, and now with the culture, people see like, and also for your personal interest, you just feel I should have more, I should try, I should have a different sex. Of course, that happens just naturally. And coupled with now, in my previous years, I happen to have had some infertility issues. Because if you see the intervals of my conception were coming after 5 years, after 7 years, and they were coming with difficulties. So it's like I didn't plan. God planned it for me. So then, this special one I conceived at 41 years. And you know, at 41 is quite advanced.
They say scientifically, they say the biological clock
has caught up with you.
Yes.
So it caught up with me, but nevertheless, I had to, because once now you are married, and you know, you really have to accept that whatever God plans and give us, we need to just receive it by 2 hands. So then this one came at an advanced age at 41 years, I had very busy schedule. I could not even attend an ANC clinic, maternal child health clinic.
Yes.
And somehow when I went to do the last ultrasound, I could not even check any other indicator. I was just told, now this is a different sex. And there I was so excited with a very special information to send back home that, you know what, now this time is a different one. Yes, little did I know that it was just special right from conception to the imaging and right now when I got the baby. So I got the baby as a spontaneous delivery. I hadn't been sectioned. So the baby came out. Of course, now I was following a gynecologist of whom now followed me up until my delivery. When the baby came out, I was so excited.
I can see it on your face.
To have seen a different sex, you know. Yes, and there I was. Hey, something special is something now. First of all, you thank God about it.
Yeah.
And now coupled with, you have to tell everyone, you know, now this is a different sex.
Yes.
This is a different sex. Oh, at last it's a baby boy.
Yes.
So we were there. But now, few hours after delivery, I noted that this baby had some difficulty in breathing. So I thought as a health worker, could be the baby got some is it meconium or something. So there was a little bit of difficulty in breathing, nasal flaring, and there I was again worried at the same time. So I consulted my gynecologist and he said, no, a pediatrician will be around to check the baby. So when the pediatrician came around, the baby was checked and they said, oh, it will just get off, don't worry. Since this is a normal delivery and there's no any complication, you're good to go. The next day I was discharged from hospital to home. Everyone was excited. We did a small bash of welcoming the new boy.
Something that was not done for the girls.
Yes, I didn't even have a rest. Everyone was calling me, oh,
boy power.
Boy power. I'm telling you, in Africa. In Africa, boy power is real power. So then, I did not rest. Right from the day I had the baby at home, I did not rest. It just started. And I was so worried. Could it be cold? It was in the month of October. 28th October, that's when I delivered. So the next day it just started. Could it be cold? So I kept on just being so nervous about everything around me. Could it be dust, you know? I kept on telling the people around me, please just have the rooms clean, everything clean around me, everything warm. And the difficulty in breathing just continued. Now, what I again realized that the baby, when the baby was breastfeeding, the baby could turn blue, and you could evidently see that the baby does not have the pink color always babies. And when the baby cries with some little of apneic attacks, you know, getting tiring when breastfeeding. So I was again worried.
The apneic attacks here, because of our viewers, means baby's
Yes, baby was tiring when breastfeeding.
Yes.
So then I could now squeeze the milk, feed by spoon, and just to observe how the baby was ingesting the milk.
Oh, and compare baby on the breast and when using a spoon.
A spoon. Now, the baby could not even swallow. When the baby had it in, now you could see a different version again, like very struggling and choking. Yes. So I just immediately went for consultation within a week, with the difficulty in breathing,
Yes.
change in color, skin color. Now I said, now I think this is not normal. And being a midwife for that matter,
Yeah.
I said no. Things started to shift on my mind. Could it be? Now I said, oh my God, I need this baby checked for mamas.
Yeah.
Just to identify if is everything okay, because I could not just comprehend having a baby at this tender age, 1 week old. I was imagining, could it be pneumonia? No. You know. Now I started now doing a physical examination by myself.
Oh, yes.
Head to toe.
Yes.
You know, when we say, please, can you examine a newborn?
Yes.
From head to toe.
Yes.
You think now it's just a walk in the park. I started examining from head to toe now.
From organ to organ.
Organ to organ. From hair to the toe. Now I was like saying, now these eyes, are they squint? These ears, one ear was a little bit larger than the other ear. The nostril, the septal, you could definitely see that it's a little bit deviated. Okay.
Oh, yeah.
The mouth, now I saw the baby a little bit.
The mouth also has deviated.
Then I said, oh my God, but how come? And I didn't have a difficult delivery.
Yes.
Now what is happening? This pulsing, where is it coming from? So definitely I could see now, everything is deviated.
And you're at home.
I'm at home. Now then, I said, now this one, let me just continue with my assessment. Chest, now you could, that sound, you could just get it. Even if someone is in the other room, they could, the siblings could say, Mama, what is wrong? Why is, and you know, this boy, we named him Papa.
Yes.
I'm a Catholic, and I named this boy.
Yes.
That year, we had anticipated the visit from the Pope to come in November.
Okay.
So the dad said, now, this is a special baby and we want to dedicate to the church. So we named him after Pope Francis.
Yes.
And coupled with my father-in-law, who was called Octave. So the name came from Francis Octave.
Hey, that is Papa.
Yes, that's his Papa now. So our Papa now, real Papa now. Yes. We are seeing real Papa now. Again, now I started saying, and this Papa of ours is just like the real Papa, as you are saying.
Okay.
Because the features were like an old person. You see now, chest in drawing, nasal flaring, the nasal you could just see, and the sound. Now the extremities, the hands. The baby is just tired, restless, you know.
Yeah.
Now I said, genitals are okay, limbs are okay. Now I said, now you see this one I have to take for circumcision.
Okay.
I have to take for circumcision first, because I happened to have been an advocate for male circumcision sometime.
Yes.
So I said, now, let me take this baby for circumcision. Before now, the worst comes to the worst. Before then. Now I took the baby for circumcision. Now is when now the symptoms worsened. Now I started saying...
Pause there. You have already seen a lot of red. These are not pink now. They are red flags.
They are red flags, but...
but you have opted for circumcision first.
Yes, I'm convinced now. I'm saying, no. What needs to be done just has to be done.
Was circumcision something significant?
For that time, for me, I felt having a male child, I should do circumcision before 6 weeks. So there I was. So I took the baby for circumcision at 2 weeks old.
Still with the eye squint, with one ear, with the nose.
Yes. knowing that even then they will assess
They will
and
yes,
tell
because
me,
it's medical.
yes, they will tell me whether the baby is
Okay or not.
okay or not. So
Oh,
when
yeah.
we went for circumcision, the baby was just taken in and circumcision was done. So we came back. That was around 2 weeks now. 2 weeks. Things just moved in a very fast way. That now I was saying, oh my God, now the baby has been done for circumcision,
Yes.
and the symptoms are now exaggerated. So you know what now as a mother, not now as a health worker.
As a mother.
As a mother now, what I did, I said, now you see this child, I think now this congestion, we need to get something like robe, those inhalation.
Yes.
Those eucalyptus. So I did some eucalyptus, dipped in water, and we could now
cover
ourselves
to
see if the chest congestion is subsiding. It didn't subside. We are now at 3 weeks. You know, the symptoms were so exaggerated that now I just said, no, this is now not normal. At 3 weeks now, I went for a checkup.
Okay.
I went for a checkup, and what the medical team could tell me that the baby is syndromic. You know, that's a very huge word, syndromic. Syndromic
means?
So I started saying, could my baby be autistic?
So what is syndromic?
Syndromic. That's a very
vague,
very huge word that they could not even just quantify the syndromic bit of it.
Yeah, that the baby is showing a lot of signs, but we don't have a diagnosis.
A diagnosis.
Okay.
Then now I said, oh my God.
Okay.
I started thinking of things like Down syndrome. I started thinking like autism.
Yeah.
Then I said now, because now it's like the baby has come with lots of congenital abnormalities.
Yeah.
And actually, with the visible view, you could see that the baby is presenting with congenital abnormality.
Okay.
Yes, now we are at the 3rd week. Now the nene erupted. One time at night, I think it was at 4 a.m., the baby now could not breathe at all. I just woke up and there was that now attack. Like
struggling to breathe.
Then there was, I woke up the dad. I told him, please can we get the fastest means? And the fastest means now would mean a motorcycle.
Yeah.
We just went by the road. We got a motorcycle to our hospital, the JTRH hospital, and to Obama ward. When we arrived there, quick enough, I was glad. They were so alert. They really received me well. I don't know if they knew that I'm also a health worker like them, but my baby was received so well. And oxygen was just initiated. They didn't even struggle to know
history or something. Just first things first.
First thing first. They just put the baby on the oxygen. Then I was like, oh my God, are we making it? Are we making it? I was so nervous, just walking around the corridor. You know, I just left the baby by the health care providers. So one nurse just came and talked to me, just told me now this baby will need more assessment.
Yeah.
By what we've seen, the baby has a congenital abnormality, and most probably the baby might be having something like a hole in the heart. It was a real nightmare for me. It was a hole. I remember the last time I heard about a hole in the heart.
Yes.
That was then when I was in the Mater Hospital as a student.
Okay.
And I happened to have done a study on a PDA.
Yes.
A PDA. That's when I had that hole in the heart. And now during my practice, I was not very keen to identify this.
Or
Here
maybe you've
comes
been doing
now.
one rotation to the other, without really being in a pediatric
and
ward.
just delivering babies.
Yeah.
And you
Baby
hand
cry.
over for for physical assessment to be done with by someone else.
Yes.
You know, that was a nightmare for me. A hole in the heart. I say, oh my God, a hole in the heart. Now,
Yes.
I just told the dad, I just told him, now, you know, our baby is like having something that will need urgent intervention.
Okay.
For me, that was an urgent intervention.
Yes.
Now, I just, they just did the emergency care. Then I called my employer, who happened to be in town, then advised that I go direct to Avenue.
Okay.
So, within 24 hours, the baby was admitted in Avenue.
Okay.
In pediatric unit. So we admitted the baby to the hospital. Then the pediatrician comes and like so many questions like parents we would ask. Then the pediatrician was like, are you a health worker? There I was. And I just told the doctor, I think my baby has a hole in the heart. How did you know? And the baby is just 3 weeks old. But you know, by the symptoms, I can guess. I'm just in thought that the baby has some congenital abnormality. Then the doctor could not release that information, but said the baby will need urgent assessment by a pediatrician cardiologist.
Whoa! But you are not being told
exactly. I think sometimes it's just good to let the parents
know what we are
know the
dealing
differential diagnosis, so that at least we start preparing early, you know, instead of beating about the bush, you know.
True.
Yeah, and in Africa, people are scared.
Yeah, they do, yes.
People are scared telling a mother that, you know, your baby has this.
This, and this. And this could
How
be
I wish we could be told that now your baby has cancer, your baby has this congenital, we suspect. And then you are told now, please do this, and this is required.
Yeah.
Yes, I think it can help us.
Do you think there's something now, let me divert a little bit. Do you think it's something with our training? When it comes to disclosure, there should be a segment of disclosure and dealing with.
Well, it's like fear of the unknown, how the respondent would take it up.
But when you say that, I wish somebody told me we suspect. You know, you are not giving an ultimatum like this is what is happening.
Yes.
But you are telling them so that they can also think outside the box. Like,
of course, yes.
We are sending you to a pediatrician cardiologist because we suspect.
Yes.
This and this and this but just somebody is telling you we are sending you to pediatric cardiologist for further assessment.
It's usually for further management.
I hear you.
So meantime, we are going to, I was told the baby has severe pneumonia.
Okay.
From my line of training.
Yes.
What I know, that these severe pneumonias are never severe pneumonias. That one I guarantee you.
Really?
These severe pneumonias that come up at 1 week, 2 weeks, 3 weeks. No. And in Kisumu, for that matter, you know, if you are in Elgeyo Marakwet, those
very cold,
or Kisii or where, we would say, the baby was exposed to cold.
Yeah.
Because the notion that we have is like, baridi ndio inaleta pneumonia. But in Kisumu, this humid climate, if you tell someone that baridi, mtoto akona pneumonia.
Severe. Week 3.
No.
Now, and I'm seeing this story.
Yeah.
You are so torn between a mother and a healthcare worker.
Yes.
There is a mommy brain that is telling you, baby will be fine. Well, I can see the nose flaring. But the nurse
could be
brain
some
is
allergy.
telling you, ngoja, what is here?
That is now the time we knelt and prayed to God,
Yeah.
because this is the only boy. This is a boy I was getting after 19 years of marriage. You can imagine.
Yeah.
Everyone, you would tell that this boy is unwell, like they would ask, I heard Mrs. Onyango got a newborn baby.
Yes.
And already it's 3 weeks and already walking in and out of
The
hospital.
hospital.
Kwani huyu mtoto ndio ako na nini? People even associated these things with family planning, for that matter. Ati kama mtoto pengine ako na issues to do with heart, pengine is family planning.
Amejipanga hiyo miaka yote.
Miaka yote. And you know, these nurses, you can't even believe in them.
Jesus.
Now,
Yes.
they can even take medicine at
work.
At work. And they come here now, they tell us, oh, I'm not doing any family planning.
I know.
But with the issues of infertility, I had previously indicated for you, I did not use any family planning method. So I was convinced this is just a congenital abnormality that was coming up.
Now you have gone to the pediatric cardiologist.
Yes. Now I went to the pediatric cardiologist who was around, and I happened to have worked with her in Mata.
Okay.
And there was, what about, your baby now has been confirmed. Of course, she did ECG, electrocardiogram, and she did echocardiogram. And then I was sent for some chest x-ray just for confirmatory. Yeah. And of course, coupled with the assessment that the doctor had done and sealed to take to the pediatrician for a confirmatory diagnosis.
I love the way you're insisting on sealed.
Yes,
they were sealed.
But you know, they could not.
Beba hii bahasha peleka kwa cardiologist.
It's like, unabeba ile bahasha unaendaka nayo kwa visa.
Yes.
Understand, when you go and have your visa interview, they seal it. You are not allowed to see it. So that is what happened to me. It was sealed.
It was sealed.
Only for confirmatory by the cardiologist, pediatrician.
Yeah.
Now there I was. Now after the assessment, blah, blah, now we were ushered in. And apparently that day, the whole family was there at the neurosurgeon clinic.
Okay.
Neurosurgeon clinic used to be somewhere in Kisumu around Tomboya Estate.
Oh, okay.
Yeah. So apparently, you know, this is a child who was so loved.
And waited for.
And all
it's
those
Papa.
years. And it's Papa.
Okay.
You know, our Papa and our father-in-law.
Yes.
Hey. So everyone was called. Now the doctor now wanted to
disclose. Now
she just started with stories. Hey, this is boy.
Yes.
But later what? The whole family is
here.
Yes, the whole family was there. Now, after a while, okay, your sibling is sick, but just leave mom and dad. We are going to disclose to them.
Yeah.
Now there we were, as helpless as we were. You know, with lots of things in our mind. Now the doctor just went straight to the point.
Okay.
The doctor told us that the baby has a big hole in the heart. Around 6 millimeter, I suppose. And this hole has to be repaired before 6 months, before the baby was 6 months. That was, now we are headed to a month old.
Okay.
You can imagine. Now, what were the implications and the requirements?
Yes.
One, we will need like around 450 at that time. That was in 2016.
That's 450 shillings?
Shillings.
1,000?
Yes, Kenya shillings for that time. And the baby has to go from surgery. The baby has to undergo a surgery. a heart surgery in a renowned hospital, because now in Kisumu we didn't have any cardiac unit providing that care.
Yes.
So either it was Nairobi, it was Tenwek, or India. Those were the options that we were told. Yeah. Now, we will need that amount of money.
The $500,000.
We would need even more, because the baby would be taken to ICU.
Oh, yeah.
Preceding the surgery.
The surgery.
And from ICU, HDU, and...
So the $500,000, let's call it $500,000, the 415,
yes,
was just for the surgery.
For the surgery. Okay. Nothing more. And also, there were other medications
involved. Yes.
Involved.
Yeah.
Okay.
Yeah.
Traveling cost, for that matter, your upkeep, in case you would go to Nairobi.
Yeah.
You see now.
Yeah.
Okay. And it really distorted us emotionally.
Oh, yeah.
Psychosocially.
Financially.
Financially, now it was worse now, because at that time, the only amount I could access was only 150, I remember. You know?
Yeah.
The only amount we could access was around 150. So then we thought, now, walking out of that room, it's like our world was just distorted, you know. Now we said, okay, now it has been disclosed now.
Now at least we know what we are dealing with.
At least now we know what we are dealing with. We went back to our pediatrician.
Yes.
And now, at that time now, our pediatrician had now the courage to tell us more about
this particular
condition
hole. Okay.
Now.
Okay.
Now he was ready to tell us, this is what I was expecting, I had suspected, you know, and, you know, we could not just say it before confirmatory. Okay? Now, please take it upon yourself. It is repairable.
Okay.
Yes. And
once
it is repaired, your baby will just live a normal life. Even if he has those other syndromic cases, all right? That was a month. Now the baby was 1 month old.
Please tell me you're going to repair it.
Me, I knew that was the definite management for that.
Yes.
So I was scared as a mother. Will I lose this baby?
Yeah.
Of course, I knew it's now 50-50. I can lose, I can have my baby.
Yeah.
But again, even if the baby would live, I was sure to have a baby who would have some dysfunction, a lot of special care, you know. Now the dad said, okay, now what do we do? I said, let's open a wall. Let's invite friends who can help us.
What are friends for?
Who can help us
to raise this money.
To raise this. Believe you me, that's when you'll get to know who people are.
Oh yeah.
Believe you me, people had a lot of discouragements that now I said, let us just face it as we are.
Oh.
That is the time nilisikia hapa kwa Ujaluoni kitu inaitwa chira.
Aha.
Because now, you know, after 1 month, the baby could not feed well. We had the weight, we had low weight.
Yeah, it should be
failure
low weight.
To thrive.
Yeah.
Now those symptoms now were coming real. Now you see the real picture. And there I was. Now, people were associating this with chira. Oh, now this is the only boy. Could it be?
Ameangaliwa vibaya.
Hii ni chira pengine.
Ulifanya shopping kabla ya kuzaa.
And for sure I did.
I've had those things so far. Yeah.
For sure I did.
Ulifua nguo za mtoto.
Yes. Those many myths and misconceptions so now many. Hated me the most.
And you know, sometimes it can shake your faith.
It shook.
Oh,
It
sure.
shook. But I'm glad in our house, I can say we are faithfuls. We are and deeply rooted
Yes.
in the Catholic
Okay.
Church. We kept on praying
Praying.
through our Mary, Mother of Jesus.
Yes.
And we said, let the will of God be done.
Please, Lillian, take us to, you have now raised this money or not?
I did not raise the money. I had to look for a second thought.
Oh,
Yes.
we have a second option.
Yes, second option now.
Okay,
Yes.
please tell us.
Now, at one time, I consulted one granny. And I said, now that granny visited me at home. And just where I stay, and said, oh, you know what? There is a traditional medicine.
Ero, sister.
That if you give some little teaspoon, hiyo kitu wanasemaga ati hole kwa heart, hata sio hole. Kuna hii ingine unakunywa, ingine wana inhale.
Okay, okay.
I tried that. Symptoms exaggerated.
Oh.
Now, one time, just within, now we are approaching 4 weeks, now we are at 5 weeks. You know, days also goes.
Yeah, and we are very desperate now.
Sunrise,
Sunset, sunrise, yes.
and the story is just
the same.
the same. My dear, it is so amazing that I got help from Facebook. I was just Googling my phone
Yes.
to check on these cardiac things,
Yes.
to read more about it, to have insight. And then I meet a perfusionist who had lots of the cardiac, pediatric cardiac procedures done. And it was so amazing. That story really ignited me.
Yes.
And there I was. Now, could you please tell me, can a 5-week-old baby go into surgery? And how is the perfusion? How is what? You know?
Yes.
Then he says, yes, why not? We even do wickled. Once the mamas and there's a confirmatory that the hole is too big,
Yes.
it has to be repaired, I mean. Do you know from then, that was at night, I could not even sleep.
You cannot sleep.
It was me and the baby on my chest.
You cannot sleep.
When I'm tired, it's the dad. When we are tired, we wake up the house help. And I'm glad this is the house help I've had for this many years, the 10 years. And I also hold her special to my heart.
Yeah.
That's why I was telling you I have even adopted
the girl, the daughter.
girl.
Yes. One big family.
Now, now this child, after getting this from the Facebook, then there was one morning, I'm telling my husband, you know, I was talking to one Muzungu on Facebook, and they say this is possible.
Yeah.
Atia, mtoto wangu haendi surgery.
Ndio hiyo.
Mtoto wangu haendi surgery.
Yes.
Si waache tu wakifika hata 4 months. You know, the baby is just 5 weeks old. Why do you want to expose the baby to those invasive procedures? Then hata mimi nikawa mkali. Then I told him, you know, the surest way. So I got my anatomy books. Nikaweka hapo kwa meza. I got this medical surgical.
Yes.
I got them. Apparently, when I was searching through my notes, I got a case study that I did on a PDA, and the file was very intact. Then we started reading through. That is the case study I did when I was a student nurse.
Many years ago.
Many years ago. Oh my God. And I said, oh my God. So, there's a way in this life. Life is very cyclic.
It is.
I studied this thing some time back, and it's now bouncing back to me.
In your home?
In my home. Right inside my home. So amazing. Now then, now it is now my time to act.
Now I see the nurse now. I'm not seeing the mother. I'm seeing the nurse.
Yes.
Okay.
Now I'm saying, oh my God. Do you mean things can work in a very cyclic way?
Yeah.
What comes around always comes?
What goes around comes around.
Goes around always comes around. And that's exactly what now happened to me. Now, I went with my phone. Hey, you see now, this doctor is saying this thing is repairable. Why don't we try? Then I was consulting the doctor. The
Mzungu doctor, the Facebook doctor. Okay.
And you know, now you people, you Africans, you are just too much on this thing called Facebook that just came the other day. How sure are you? You are conversing with somebody whom you can't even reach. But I'm reaching this person on Facebook. Then he just told me on the inbox, on my Facebook inbox, kindly give me your contacts and tell me what time you are free so that I call you.
Yes.
I remember I mentioned 10 p.m. the next day. 10 p.m. I was called 1 minute to 10 that day. He called me 1 minute to 10. And it was clear. He just told me, where are you in Africa? Because your number shows Kenya. Where are you? I said, I'm in Kenya, Kisumu. And he asked if I knew about a hospital called Tenwek in Bomet. Then I told him, no, I might not know it, but I can look for it.
Yes.
If help can be found there, then I can look for it. Then he asked for the details. Then I told him the baby is called Francis, blah, blah, 5 weeks old. And this baby is a 5th born in a family of 5.
Yes, you gave all the details.
I gave all the details, coupled now with all the information that
the lab
works and the investigations so far that had been done. Then he said, now, can you scan those the next morning and send me? I went in the morning to the cyber, scanned and sent. But here at home, baby sasa ndio ile sauti
inatoka kabisa.
Inatoka.
Yes. That baby cannot feed. That baby cannot thrive.
I bought a breast pump.
Yeah.
He could not breastfeed.
He could not.
I bought a breast pump. We could only just give
a spoon at a time.
A spoon at a time. In waiting for what the angels and God will
bring forth.
Now, do you know I got helped from the Facebook? Now, the next day now, after 2 days, the perfusionist called me.
Yes.
And the perfusionist gave me contacts of one Dr. Liske. That is the name I can remember.
Yeah.
Dr. Liske. Call this contact. The missionary doctors will be in and they are coming for cardiac surgeries in Bomet Tenwek Hospital. I'm also giving them your contacts so that you go, have the child go for assessment, let it be done, and then you let me know. Now we set off
to Tenwek.
After some 5 days, we went to Tenwek. Just when we hadn't reached Tenwek, now I was arranging for funds and what have you. Then I secured some loan of an emergency loan of 150,000 shillings.
That is what you go with.
That is now what I go with, but it was right in the bank. I just held it.
Yes.
Going to Tenwek that morning, I remember we set off. We called our taxi man. We paid him. We told him we have a sick baby and we are headed to Tenwek and we have to reach today.
Yeah.
That was on 8th now. On 8th 8th of, that was now February.
Okay, February.
February. The baby
Okay.
was now around 3 months.
Okay.
3 months. But with a weight of 3.4.
Okay.
You can imagine.
Yeah.
So emaciated, failure to thrive.
Yeah.
The baby looks like an old man. It was really hectic. You could now cover the baby and nobody would even see that baby.
Yeah.
Eh?
You
Even if
bundle it.
visitors would come home, I would just tell him, mtoto analala.
Yeah, amepumzika tu huko.
Unaona? Hiyo stigma ya people would associate the baby like
so many things. Yeah.
And for that matter, a health worker having a baby like that.
Oh. That's something else.
That would mean so much, you know.
So you're in Tenwek.
So we are in Tenwek.
Yes.
We arriving, we were ushered into the cath lab. I met Dr. Liske there.
Yes.
Dr. Liske assessed the baby. We did the assessment again. I presented my lab works.
Yeah.
They said they have to do a repeat again.
All right.
Of the lab works, echo, ECG. So they did. The whole was confirmed. Too big for life. The baby had to be scheduled right away for surgery. Okay. That was 8th. We were now looking for, they told us to get donors. We'll need like 3 pints of blood. Apparently, the baby had a B positive like the dad. Now I have to really say, sometime we meet angels on our way.
Wow.
I met 2 students who donated blood for me, for the baby. In that surgery, that was the youngest baby in that season that was amongst the people who were done for heart surgery.
Wow.
On 8th, that was on 8th, we were admitted on 8th that day.
That day, yeah.
Surgery was done on 10th.
Oh, that was fast.
On the fateful day of the surgery, I call it fateful because I never knew my baby would come out of theater alive.
Oh, okay.
But I thank God.
Yeah.
That I saw the hand of God. I saw miracle. For me, this is a baby whom one of my priests usually call him a miracle baby. Before we went for the surgery, being a faithful of the Catholic, this baby we had to be done for what we call an emergency anointment.
Okay. Upako wa wagonjwa. Upako wa wagonjwa.
So this baby was baptized.
Yes.
A day prior to our traveling. And I really thank our priest. I remember words like, this baby will live to proclaim
the word.
The word. And for sure, he has lived to proclaim it. Our miracle baby, he has lived to proclaim it. Nobody knew. But from the words the priest said during baptism that day, that one morning, we were just the 6 of us. Me, the dad, the priest, and the godfather.
Yeah.
And he said, this baby, I am laying my hands.
Yeah.
And I'm telling you, believe it now. You have to believe that this baby will live to proclaim the word. And for sure, he has lived it.
So that tells us baby will go to the surgery and back.
The baby got the surgery. But before the baby came back home, the baby had some, I don't know if I can call it an adverse effect or something. Something happened in a very queer way. Just after surgery, after a few hours after surgery, the baby now had another attack after surgery.
Okay.
The surgeons, pediatrician surgeons had to be called. I remember they were just rushing. Me, I was in the general ward, but they were just rushing through the corridor with their pages, you know. Oh, our baby, you know. And it was like I was dreaming. Then I was called. Mama Francis, please come over. Then I went and they told me, even the chaplain was there in the HDU now. I was told Now we are praying to God. We don't know what will come up, but we are praying to God. This is just a sort of an adverse effect that has happened. The baby was rushed, done for X-ray, and they found that the baby had some abort of sort of air in the tract.
Okay.
So they managed that. The baby had it 4 days in HDU, then came back to the general ward. When the baby arrived in the general ward that day, it was a celebration. All the nurses, even the guardians who had other patients.
Yes.
I'm telling you, it was a celebration. They could not believe such a small baby has made it.
Yeah.
You know, has made it. We were discharged. Before discharge, another miracle happened. Courtesy of Dr. Liske, Dr. Roos, Dr. Agneta, those pediatricians.
Now the names are coming.
Yes.
Yes.
I'm telling you, they said, we are waiving this baby. I was just told to present my NHIF card, and the rest of the monies, the 250 that was to be taken, was waived.
A waiver here means she did not pay. The hospital came in and paid.
It was just like a gift.
That is a gift.
That's
a miracle.
Gift.
Yeah.
So I can say, since I delivered this baby, this is a very precious baby and a miracle baby for that matter, because things just went the way, in a very miraculous way that I cannot understand by your understanding.
Let me ask you, how old is this Papa?
This Papa now is 9 years, almost turning 10. Actually, in coming October, he will be 10. He's in grade 4.
Beautiful.
He has grown. He has overcome all these symptoms. The only challenge we had in his milestone was he delayed speech until 6 years.
6 years?
Yes.
Okay.
Delayed speech until 6 years, until we had to go in for sign language. So we did little of sign language. But now he's telling us, mimi sitaki mtu anaongelesha na sign.
Oh. You all had to go and learn the sign language.
Yes, a little bit. Even if in my house, in my living room, if you come, there's that Kenyan chat for the deaf. Yeah, we know sign language a little bit.
No, he doesn't want it.
He doesn't want it
because he can speak.
Yes, he can speak.
He's a miracle baby.
And another challenge now he's having, I told you, he's syndromic, and for sure he's syndromic.
Okay.
As he was growing, he had tantrums.
Lilian, every child has tantrums.
No, but it was
on the upper side.
You know, if he could get angry, he could even hit his head on the wall. Like he's so angry.
So much, yeah.
So much. If he gets sugar, too much of sugarish, like sodas, and he likes sodas. But if he gets sodas, we realized,
energy.
Kama anarukwa na akili.
Sugar rush.
So he's at the borderline. We can't say he's autistic, but it's at the borderline, of the spectrum.
But he's independent.
He is independent. He's the best dancer in school. Even if you could get time and dance here,
oh my good Lord,
you could not believe. He rides bicycle.
Nice.
Just for healthy heart.
Yes.
Yeah. I invented that so that he gets his heart healthy.
Yeah, exercise a little bit.
He does skating. He does.
So that means he's living his life to the fullest.
Fullest and normal life. But what I was also told, when you have a special baby, please do not discriminate this baby. Let this baby give love.
Yes.
Let this baby live a full life. Embrace it.
Yeah.
Accept it.
Yes.
Accept it. Don't deny that baby. He's not in a special school.
Oh.
He's not.
That was my next question.
He's not in a special school, although few months ago, we had planned that we take him he has done several assessments. This time round, like last week, we were seeing an ENT.
Okay.
Because of his hearing.
Yes.
We realized one ear does not hear well.
Ah.
Yeah, so he's seeing a ENT for that. But he doesn't want a hearing aid because he was being prepared to get a hearing aid.
Pole pole.
Na anasema, mimi sitaki kuweka kitu kwa masikio.
Oh, wow.
Yeah.
He's so determined.
He's so determined.
He has been determined right from the word go.
The only challenge I've seen that he can't comprehend reading. Like he's saying, Swahili sitaki, Swahili ni ngumu, you see, and then he can't read. Last night, he was given something to read. I was calling the teacher and nasema, sikusikia muzuri, you know, he talks so soft. Sikusikia muzuri, call teacher, uniambie alisema nini. Then I was calling the teacher and now he was saying, namwekea loudspeaker. Sasa umesikia, hey, what does the teacher say? Read na weka notes. So we were reading something like moving an object from a smooth area. Difference between moving an object in a smooth area and a rough area.
Yes.
Yes. Now he could not even comprehend writing those notes. And I was like, so I'm seeing challenge in reading. Yeah, but maths he even knows better than us. He tells you, if you say, like we've always tricked him, tunaweka something, kama ni 3 plus 2, tunasema, hiyo si uandike 2 4. No.
He has to count and confirm for himself.
So his nini for maths.
It's okay.
So that's why I think he's more of
borderline. You've done well.
What has really kept me, number one is the faith.
Yes.
Everything in life, please just believe that it is possible.
No, I think you should look at one of the cameras and tell us what has kept you. Let our viewers who you are encouraging learn what has kept you.
My special viewers today, I want to humbly say that everything in this world, please believe in God. Take everything upon your knees and it will be done. Even if it is a very difficult moment for a time, just embrace prayer and put God first in everything you do, because my journey has been so miraculous that even me myself, I don't understand how it has, but it has been quite an encouragement to me, to the family, to the community at large, and to encourage you, if you have a special baby, please just do not discriminate this baby. Do not see like you are a lesser human being having a special baby. These are all humanity that needs to be embraced at a time and given an opportunity also to live. Yes.
Wow.
What has really put me as a health worker, early identification of such conditions and quick and prompt intervention. And for those who do not have the know-how or do have little knowledge on things around us, please embrace going to clinics, embrace listening. Nowadays we have what we call the Google, and everyone, for that matter, 3/4 of the population have phones. Just embrace checking on this Facebook, this YouTube. I really admire the way youths are. They get information from the technology. Let's embrace technology. It can help us. It can help us a great deal, because it is the technology of Facebook that really helped me in the intervention of my son. Coupled with the community, Let us please avoid myths and misconception. Let's avoid them. Let's embrace one another. Neighborhood. Usione wako amelema ukafikiri uko mbali na hiyo ulemavu. Ulemavu upo. Na uwezi realize sometime. Sometime the next person next to you can have a solution that you might not know that it will really impact in your life.
Beautiful.
Yes.
Wow.
If I want to talk about cardiac problem now as a healthcare provider, let us identify these cardiac problems, especially for the midwives and for people who happen to get in touch with the young babies. Let us embrace examination at hand, assessments at hand, so that we identify these problems and intervene appropriately. Dieting is very key, and investigations are very key. And I want to tell the mothers now that you say this thing called IFAS, sometimes we find mothers are given to the clinic and you throw them away. Hii dawa inaitwa IFAS. Mukunywe kabisa. Hii dawa ndio mimi sikukunywa. Mpaka at one time nilifikiri labda ni hii dawa imeniletea hizi congenital abnormalities. And for sure I think it had some little effect.
Now that you didn't take it.
Now that I didn't take it.
And you know all the benefits.
And I knew all the benefits.
We have heard it from the horse mouth. What a purposeful journey, full of faith and learning points. And this comes from deep down my heart, where I've read in social media and I've seen a lot of us blaming our healthcare workers, and especially the nurses. We even go out there saying, don't they have a heart? You know.
We do, and we have a big heart.
And it's because we like judging people. And we forget that even a nurse is human.
Yes.
So today, I'm sure this is not the first or last episode that we are going to learn from our own nurses, and separating that cape of being a nurse and being a mom, being a nurse and being a sister, being a nurse and being that auntie, that mother. They are human, and they also put on very different shoes. So we keep it here at the Mamatoto Lounge, where we do a lot of learning and unlearning. And today, this story is of pain and purpose, of faith and victory. And we are very, very happy to have you. And you are doing an amazing job. Remember, we are at the Little Cave. And this and many more episodes are brought to your devices by Chanuka Studios. Chanuka, we are forever grateful, and their offices are found in Kondele. Please keep it here. I remain your host, Shikari Rosemary, a lactation specialist, a doula, and a childbirth educator. Till next time, bye.